Okay, so now I will call to order the meeting of the Pahang Valley Healthcare District Hospital Corporation, also known as Watsonville Community Hospital, for this regular meeting for Wednesday, August 27th, 2025. Rosie, when you can, please give us a roll call.
Yes, Director Cox.
Here.
Director Creel.
Here.
Director Gallagher.
Here.
Director Pimentel.
Here.
And Chair Nunez.
Here. There's nothing to report out of closed session. Now I'll go to staff and ask for any agenda modifications for consideration for today's meeting. None. Okay, seeing none, I will move us on to the public comment for matters not on tonight's hospital corporation agenda. Is there anyone wishing to speak on items that are not on tonight's hospital corporation agenda online?
No hands online.
Okay, anyone in person wishing to speak on something not on tonight's agenda? Okay, seeing no raised hands, I'll end the public comment portion and I'll open up to comments from our board members. Any comments from our board members before we move on to the consent agenda?
Yeah, I have one.
Please, Alex.
I got to visit the cath lab opening, and it was really amazing to see all the hard work that went into getting to that point. I know it was a long goal, and so I just applaud the staff that's put so much hard work into that, and the community for helping support that. And it was really amazing to be able to attend last week.
Anyone else on the board wishing to make a comment? I'll just, I do have a quick comment, just one, just again, thank you for staff and thank you for the foundation for helping put on that walkthrough for some of our community partners and some of our donors and for our staff to see the completed cath lab. I know that we had several folks here from the community that were able to get a great tour, including the mayor of Watsonville and the city manager and some of our representatives from Kaiser and from the county of Santa Cruz and other local partners. So just thank you for putting that on and for allowing folks to come in to see the completed cath lab, and get a firsthand look at us, how we're able to and have been able to continue to add services back to Watsonville Community Hospital. Just appreciate the work there. Then the other one is the other thing I'd like to mention here is to just give a quick plug. I know we're about 2 weeks away from the Hospital Foundation Twilight Tapestry Gala. I just recently got my tickets, and so just very excited to hear that. I believe last year we had somewhere around 200 attendees, and I think we're right around there as well again this year, which is awesome. I was very delightfully surprised at just how well that venue worked for us last year, and so I'm excited to go back. It'll be at the top of the 6th floor parking garage over at Watsonville Civic Plaza. So if you have not purchased a ticket yet or thinking about purchasing a ticket to support both the district and the hospital, please do. I'd love to see you there. With that, if there's no other comments, I'll move us on to the consent calendar for today. Seeing no other comments from the board, I'll move us on to the consent calendar. We have 2 items. The first is the minutes approval for the July 30th, 2025 and August 4th, 2025 meetings. And then the second is a policies / policy summary approval for August 2025. Are there any questions from the board about either of those 2 items before I open it up to a public comment? Okay, seeing no questions, I'll open up to public comment for the consent calendar.
No hands online.
Okay, anyone wishing to speak on either of these items? Okay, seeing none, I'll close down the public comment and I will entertain an appropriate motion for the consent calendar. I'll move approval of the consent. Can I get a second?
I'll second.
Okay, I'll take roll on this item. Director Cox.
Yes.
Director Creel.
Yes.
Director Gallagher.
Yes.
Director Pimentel.
Yes.
Chair Nunez.
Yes. Okay, we'll move on to our discussion items. First one is item number 3, and it is a medical executive committee's report approval for August 2025. It's a report that we received in closed session from Dr. O'Grady, the chief of staff. Any questions from the board to staff about this item before I open it up to public comment? Okay, seeing no questions, I'll open up the public comment on this. Anyone wishing to speak on item number 3 online?
No hands on mine.
Anyone in person? Okay, seeing none, I'll close down the public comment and I'll entertain an appropriate motion for item number 3.
I'll move to approve the MEC report.
Can I get a second?
I'll second.
Thank you.
Thank you. I'll take roll on that item. Director Cox?
Yes.
Director Creel?
Yes.
Director Gallagher?
Yeah.
Director Pimentel?
Yes.
Shannon?
Yes. Okay, thank you. We'll now move on to item number 4, and that is the Chief Financial Officer Monthly Financial Performance Update. Julie, whenever you're ready.
Thank you. So first slide is gonna show our month-to-date income. Are you still getting?
Almost there.
Okay.
Now we're up.
Okay, so, July was a pretty rough month for us. We had very low volumes in the month of July. And therefore we had very low net revenue of just over 10.6 million, which is about 3.6 million less than we had predicted in our budget. And as a result, while we did do some cost reductions, we were about 700,000 favorable on cost, but, that's still a significant loss for the month at 2.5 million. Next slide. So here's how we're looking kind of on a year-to-date basis, and we're $11 million loss for the year. A couple of things of note is we've been talking all year long about volumes being lower than 2024 and kind of what we've been seeing a lot in the net revenue side. So I went back and just did a comparison to July year-to-date 2024, and we are $8.3 million less in net revenue than we were last year, plus $1.6 million less in the other operating revenue, which makes up, we have net patient revenue was the 8.3. And our expenses are $4.2 million higher than prior year to date. So that really explains a lot about what we're seeing here. If you kind of break it down in terms of an adjusted patient day, how we kind of capture a high level stat to capture things. Our net revenue is $100 less than last year per adjusted patient day, while our expenses are $560 more. We certainly we've done a lot of flexing, and we saw some of the fruits of the flexing, even though we can't always flex all the staff volume down to the volume that we have. But as we've talked about, we have higher professional fees this year due to a lot of the things going on with the radiology group, the hospitalist group, and other physician groups that have come to us looking for increases. We've done pretty well in controlling supplies. We tend to be running pretty well in budget around the utilities and purchase services and the other kind of non-volume driven expenses. But it's been a tough year so far. Next slide. Just like last month, I gave you a little bit of a view into that net revenue variance. Very similar in that it's really still split kind of in the 3 ways, between about 30% of it just being the fact that we have that less volume than we were at last year. If I kind of combine case mix and service mixes, they're very similar. That's about 27% is just the services that people are getting from us. Becomes pretty apparent when you look at the breakdown of what is inpatient services and our variances to budget versus outpatient services. Outpatient services, while we do a lot of them, bring in a lower reimbursement rate. And then the collections, which can be a mix of the actual payer mix as well as just our ability to collect on accounts, and that makes up the other third roughly. Next slide. So here you can see on the month to date stats, July was just a very low inpatient. We averaged 24 patients per day. That's probably the lowest I've seen in my 2.5 years here. We also had a very low length of stay, which is kind of what contributed to the lower average daily census. But we were also, 21% short on admissions. Our ED visits were down almost 15%, and our outpatient surgeries were down close to 30%. A portion of that remains to be the cath lab, but we also saw, fewer surgeries in like ortho and general surgery, which is places that we currently have some physician holes. Next slide. So on the year-to-date stats, pretty similar. I think July was a little harsher than most months, but running year-to-date about 13% below in admissions. So we knew that we had budgeted for some things that we put pauses on, such as pediatric admissions. We knew we had lower volume. So I took another look at, well, how does this compare to where we were at this time last year? And it's actually, it shows how many kind of initiatives that we budgeted for that we haven't quite met. Because when you compare, say, admissions, we had 1,865 admissions at this time last year. So we actually are up a little bit in the admissions, even though we feel like we've felt that drop. Length of stay is definitely one that's different this year, because at this time last year we were at 3.75, and this is 3.34. Deliveries were up about 36 deliveries this year over where we were last year. But on the outpatient surgeries, we're down about 124 from where we were at this time last year. And the ED visits, that one actually surprised me, because I usually think of things in terms of 92 per day, 96 per day, but we're actually down year to date 983 ED visits from where we were at this time last year. Next slide. Look at the payer mix. So payer mix, I do tend to kind of monitor more on that month over month swing. And, this was not a strong month for us with commercial mix at 12.5%. After being at 17.5% last month. And that represents 18 fewer commercial admissions in the month of July. We also were down about 24 admissions in Medicare admissions. Where we increased was our straight Medi-Cal, that we were up about 8 there, and we were up 5 in self-pay. Sometimes the self-pay ones, they will convert to Medi-Cal after the month end. It's kind of a timing issue there. So I'm not as concerned there, other than kind of not knowing what's ahead of us as patients try to qualify for Medi-Cal. On the outpatient side, similar story. We had decent commercial mix at 25.1%, but that was still a 71 visit drop from June. We were down about 34 visits in the Alliance Managed Medi-Cal bucket. But our Medicare volume actually went up at 20.4%. That represented 91 more outpatient visits for Medicare patients. And then we had about 10 more for Medi-Cal patients. Side. I'm just going to spend a minute giving you a budget update given where our volumes have been this year and kind of seeing the stronger decline that we saw in June and July, as well as a lot of the unknowns ahead of us with the budget bill and whatnot. We went back and we looked at our volume again, mainly from the perspective that volumes drive so much of what we budget, because they drive staffing, they drive revenue, they drive supplies, and then to a lesser extent, some of our more fixed costs in the purchase services, things like that. But we decided, we don't want to be, number one, we don't want to be missing budget by so far like we are this year. So we want to be very careful about how we're trying to project volumes. When we did our first pass of the budget, we were looking at a rolling 12 months through May of 25. So we went back and looked at a rolling 12 months through July. Basically, really looking at what happened in June and July and how much of that kind of drop off should we try to figure into our projections. Also thinking about things like the open position, surgery positions that we're going to fill, but there's gonna be a ramp up period. And thinking about the fact that some of the volume we've lost due to, you know, fears of immigration issues or potential folks that may not qualify for Medi-Cal in the future. We decided to be a bit more conservative. So we updated volumes. I'm not gonna go through these in great detail, but rather to say at this point, you can see where we dropped some of those inpatient admissions and patient days, you know, 13 to 16%. We dropped our ED visits by about 5.5%. We still feel pretty strongly our outpatient visits have continued to grow and climb even through some of the uncertainty over the last couple of months. We know we've got, you know, some big efforts coming in with new CT, new MRI, that's gonna give us more capacity. We're working on scheduling in other areas where we've know we have some pent up demand and it's just a matter of working process flows. So we are still favorably, you know, budgeting an increase in the outpatient side. And then we've dropped a bit down in the outpatient surgeries. One of the just key tenets we do with budget is we always try to budget our base first, which is kind of current business, and then we layer on initiatives. This year, Cath Lab was an initiative because we had expected we were going to open sooner. Given that we didn't open until July and we're relatively low volume at this point, we are going to treat Cath Lab as an initiative again next year. So it's not in these surgery numbers that you see here as kind of a base. And, you know, we have continued to have the delivery volume. You know, this is one, when I first saw it, I kind of questioned, oh, wow, we're adding 60 more for next year, but the volume the last couple of months has sustained, so we decided to go with that. Next slide, I think I'm up to questions.
Questions for Julie?
Just a comment, we've spent a lot of time, as we've been doing a lot like recently on the finance committee, Dr. Gallagher and myself, regular committee members. And I think it's important to note, we have made some staff that's presenting and we support substantial reductions in our assumptions leading towards next year's budget, but we're still in the very rough stages of thinking about next year's budget with the timeline. So too early to start working those numbers as staff will continue to evaluate that. And this board and expect to have a return conversation in October and November with the idea to adopt our budget by December. Our finances continue to be a concern, and we spent a lot of time discussing the ongoing erosion of some of our payer mix or volumes. Even it's concerning. It's something we didn't expect to happen this year when we were developing the budget a year ago. We were a lot more optimistic, and I thought incredibly so with this year, not optimistic, but we were confident in this year having from a conservative manner, having the ability to have a small surplus. And right now we're so far from that trajectory. It's, as Julie, our CFO, mentioned, $17 million short on revenue was not our plan. And this is something that's happening to us, and we're having to adapt and find a pathway out. And I do want to acknowledge all the staff who've been working on this and our leadership team who continue to look for ways to hold costs in check where they can. It's often resulted in adding more work to other people. And we recognize that, our board recognizes that, that is our intent. I appreciate everybody's efforts to maintain this hospital the way it is right now. And we have still a lot of pathways and strategies that are moving forward, in addition to our long-term strategic fiscal plans. Other short-term strategies to bring in more resources into this hospital, including cash. And we recognize that when we took over this hospital, it was at a very delicate cash position, way below where any normal hospital should have a starting cash balance. So that put us at a deficit in the beginnings. We don't have the cushion to wait. So I just want to acknowledge these are tough months. I'm not sure we're seeing anything that would indicate we're going to have a huge turnaround in August. So we're going to have to keep buckling down and understanding that our months are problematic right now. I don't know that we have a lot of solutions yet, but we have a lot of small incremental stuff we're doing collectively, and I appreciate the staff and looking at flexing schedules and finding opportunities in supply management, looking into revenue options, revenue management. So it's a lot of words, but I just want to acknowledge this is not the year we expected. And it's more happening to us than what we're doing to it.
Neither.
Can I just ask you a question to make sure I heard you correctly? Did you know? Have we had more than 900 fewer ER visits
Yes,
since?
year to date.
Year to date,
Yeah.
July 24 versus
Oh.
year late to date, July 25 is 900, and I think I said 83 fewer
Uh-huh.
visits. So we were busier last year.
Yeah, okay.
Really, my question is more so on the items that are listed in the appendix. I'm not sure I'm understanding
Sure.
the July version. That was
Yeah.
the version that we had prepared and that we were rolling into for this upcoming.
Sure.
Yeah.
The version I showed as part of the presentation is current, where we're currently sitting. The July version is, we had done a prior, I brought it last month, a kind of a prior view with the higher volumes.
Right.
And then the last page is July versus August, just so that you could see where
The
the
revisions.
changes were.
Okay, understood. Anyone else have any other questions for Julie?
I think most CFOs would bring you a budget at the end and Julie's kind of showing you the sausage making process as she goes along.
Some of the commentary we had yesterday should have shared is this is in a positive way, very atypical to have such a transparent CFO bringing early assumptions. Typically, I think most CFOs would be hesitant to bring such early, estimates, but I think we're fortunate and we appreciate the approach of our finance team to have these candid conversations early and to make sure we're tracking on that and not to be embarrassed and say this was our assumptions in July. We're now having to downgrade those, even though right now we've probably downgraded them at a level that's below our year to dates, but we're still trying to factor in what the impact's going to be for next year. So what I want to also echo is our August presumptions that will change in September, probably be modified again in October. Currently, right now, our August presumptions don't yet quantify necessarily the impacts of HR 1 and how that's going to compound our issues. Because I think collectively, we're still trying to understand that at a micro level on when you're looking at all of our key data points. How will it impact the commission? How will it impact ER visits? Right now, we have broad assumptions, but nothing too definitive. So I just want to acknowledge that the data you see up on the screen does not yet reflect the full impact of HR 1, the federal policy changes that are eliminating, destroying Medicare.
Julie, I'm wondering, I don't know if we have data available of other hospitals like us across the state of California that are rural hospitals or serve the same sort of patient populations as we do. If other hospitals are also facing these sorts of year-to-date challenges in their budget projections or just their inpatient, outpatient services. And then also, I don't know if I'd be 99%, assuming that some of our other healthcare providers don't have the same level of transparency as us in terms of their volumes year to date and how to see if they're also dealing with the same sort of challenges in terms of volumes.
I was on a call a month and a half ago or so for the the group of hospitals that received a distressed hospital loan. And while we didn't address exactly everything you're asking, we were talking about, kind of what did you get the loan for? What did you do with the loan? How are things going now? How are you surviving? And this was, it was probably happened right after the budget bill was, I don't remember
Sure.
exactly the date, but it was almost too early to start talking about the budget bill impact, but the stories from that report out were very similar across 16 hospitals. I don't think all were quite as transparent about their days cash on hand, things
Sure.
like that. I mean, I think some of them sounded like a little too good to be true. But for the most part, it was very similar stories, very similar challenges. We were talking with the group from HCI and even, Treasurer Ma, State Treasurer was on. In fact, we're going to invite her to come visit us at the hospital, because they heard the message loud and clear to say, hey, all of us hospitals still need some resources to, we're not out of the woods.
Mhm.
Yeah, as far as how other people's volumes are going, I don't recall us having that specific of a conversation.
Mhm.
But I would imagine that in some of the places that, have similar immigration, concerns, that they are seeing similar
Mhm.
things like we are.
And that's what I've heard as well, that others are experiencing things like that, but I haven't taken the time to go find their public reports to see
Right.
what their
Mhm.
volume numbers actually look like, but
Mhm.
could certainly do that with the ones that are public.
Mhm. Okay, any other questions before, I don't necessarily have to open it to public comment, but I'd like to. Any other questions? No? Okay, Rosie, anyone, I'll now open up the public comment for, item number 3, or I'm sorry, item number 4, this, CFO monthly financial performance update. Is there anyone online wishing to speak on this item? Okay, seeing no raised hands, anyone in person, please?
I know that I can't ask directly, my name is Roseanne.
What you can do, Roseanne, is, if you ask your questions, then the board will decide if we could relay them that way. Okay.
My name is Roseanne Ferris, nurse here in critical care. And I'm gonna phrase it as a question, but what I was saying is I know I can't ask directly, but I'm gonna phrase it as a question and see if you can answer it. So I know that perioperative services is a moneymaker, and I know that we've been discussing in the past how there's gonna be more of a focus on having growth there. I'm wondering when and how, and when we're gonna get to that point, because I'm curious if that would be helpful. And then another thing that I know a lot of staff have this concern is, yes, we have the cath lab open, and that's wonderful and great to have that service. It's also at the expense of our hospital. And we also want to know, when are we going to get to the projected numbers of having cases to help pay for those bills? Because I recall previously when we were talking about the cath lab, we talked about how there's a lease that's involved with the equipment. And I also see, the director and the staff and all that. And so, yes, we are very concerned about, when are we gonna get those projected numbers?
Thank you.
Thank you.
Okay, anyone else wishing to speak on this report? Okay, I'll close down the public comment, and, Steve, if you can address just I think the cath lab is more difficult to address of when we're gonna be able to
Yeah.
see the numbers of which that we projected, and now obviously with what we just got from Julie about it being moved forward as an initiative in 2026, that might be a difficult one, so I don't know if you can answer that one, but the previous one, do you give any sort of context about? strategic direction on that?
Yeah, so on the cath lab, I think, made a note, Roseanne, thanks for the question. I think we should bring back really kind of a break-even analysis on that and see if we can put our best heads together. We are making, we'll be making a sort of a strategic pivot now that we've opened it, it's licensed, it's available, everything is ready. We really have realized, or the smart clinical people who know these things much better than I do, that we need to really streamline the clinical workflows. And so there's a little bit of a leadership and strategic pivot around that and how we're going to make sure that those workflows are there for recovery, whether it's an outpatient or the workflow over to the inpatient units. Realizing that we need to do all of those things and have those super dialed in to make sure that they're really dialed in before we get to the point where we're just doing lots of volume, right? We want to make sure that we have those clinical workflows in place before we're just bringing a bunch of patients in there to bring them in there. So that's really something that, you know, we've learned from doing drills through the cath lab, as well as really the first patient we had. Like there was questions like, okay, what if this happens? What if this happens? What if this happens? What do we do next? So with those learnings, we need to make sure that we do that. And so we'll definitely involve staff, like folks in the ICU and others, to make sure that we're doing those things right. So I don't have the volume projection numbers at this point yet, but I think that's going to be part of this growth and development of the next phase of our cardiology services and our cardiovascular services. On the OR, Roseanne, if you'll stay for my presentation, I'll actually talk about that a little bit at the end. Some of the things we're doing with the operating room, with surgeons coming in, and with dollars that we're going to be able to invest in there.
Okay. There's nothing else. I'll move on to item number 5, the Chief Executive Officer report. Steve, whenever you're ready.
Yeah, thanks. So before I get into the slides, I do want to make an announcement that a couple of you are aware of, a couple of you might not be aware of, but that we just announced a leadership team earlier this week, and that's that our Chief Nursing Officer, Phyllis Stark, is going to be leaving us. So she is going to be taking out another role that allows her more time with her family. She's actually going to be taking a VP role for a company called Human Good, which specializes in aging wellness research and post-acute care across the nation. So she's very excited about that. She'll be able to do a lot of her work from home, where she can care for some family members that are needed. So we're bittersweet in her loss. She joined us in May of 24. And I wrote down, she's done a bunch of stuff since she's been here. So I wrote down some of them. Successfully navigating a number of regulatory visits, including one that went well today, leading the team for getting ready for that, establishing nursing forums and workplace violence prevention committees in concert with staff, developing palliative care team and those services, reinvigorating the service league volunteer team. And she's really worked collaboratively with our physician leaders to improve care delivery and develop some service lines. So we're super happy with what she's been able to provide here and accomplish here in her time here. We will miss her. She's on vacation right now, which is why she's not here. She'll be back and she'll help us with the transition. We have some of our wonderful nursing leaders that are still here, that are in the room here today, and we'll be working on what all that transition plan looks like as we move forward. But I wanted to acknowledge that before going into the other stuff. Okay. So HR1, I've done this presentation with you already. I'll give you a couple of things that I haven't brought to the board, at least to the full board quite yet. There's one graph that I haven't shown everybody yet that I'll show you, but I've done this presentation. Julie and I have been talking about the impacts of the big bill on our future finances in a lot of different places over the last couple of weeks since we put these numbers together. I'll actually be meeting with some reporters tomorrow to talk a little bit more about it. We just feel like it's, and people are asking, right? They're asking, what is this bill going to mean for the hospital? what is it gonna mean for healthcare services in the county, in Oro Valley, so we're being as transparent as we can about what we know and what we're learning about. And just as a recap, projections, are obviously not good, 3.5 to 5.5 million next year of revenue reductions. And going up each year from there, and the graph that some of you have seen, but some of you might not have seen yet, is this one, which the top line is that blue line, which is that was kind of the best case scenario from the strategic plan that had us accomplishing the items in the strategic plan and passing the bond measure. So all of that we've done. So that was the strategic plan's best case scenario for 26 through 28. And the big bill brings that line right down to the orange and red lines, which could get even worse depending on the decision around the hospital fee program, which we won't know until December or January. So we're continuing to tell that story. We'll keep telling that story so people are aware. As we get to our gala in September, we'll have that conversation more. People who are wanting to support the hospital, they want to know what's ahead of us and what the challenges are ahead of us because they want to help. The July dashboard is a tale of two halves. The first half looks pretty good. We're at baseline, kind of halfway between baseline and the full performance target on our patient experience score. So the likelihood of recommending the hospital, 72.2% of patients saying they would definitely recommend the hospital. Our safety priority index, which is all of our hospital acquired conditions, annualized, we've jumped over the target. We're past the target. So we're on pace for annualized number of 7 hospital acquired conditions for the calendar year. We were at 15 last year and we were over 30 the year before. So this is really like we keep putting that 50% reduction stretch goal each year, and the team has so far done it, knock on wood, through 7 months, is on pace to do that for this year, which is pretty darn remarkable. Caregiver safety, we were in the red for the first part of the year. That has come back to baseline, which is really the same as our performance from 2024. We're on pace for 55 employee and provider injuries for the full calendar year through the first 7 months. Since that's come down, we've had a couple of months where we've had just 1 or 2 or 3 injuries each month. So that's been a good trend. The Workplace Violence Prevention Committee, I think, has done a lot of really good work to let people who are about to enter a patient room know that a patient is violence outburst risk. And that has brought some of those numbers down. We're seeing a lot of those at the very beginning of the year before the team has done a lot of work there. And staff retention is better than target. So again, those targets, 75th percentile and just the 90th percentile nationally, those are based on all hospitals across the country, national benchmarks, and we're right in between. So we're at 85% staff retention or a 15% annual turnover rate, which is, as I said, somewhere between the 75th and the 90th percentile nationally. So close to best practice for hospitals across the country. The bottom half of the dashboard is less good. Red is those opportunities for improvement. So the SCORE survey, the safety climate, that one is just a once a year thing. We'll try to do our own SCORE survey, kind of a pulse survey later in the year. But we had 25% like people with really positive things to say about the safety climate, which meant we had a lot of folks with either neutral or negative comments on the safety climate. So we know we have work to do there. The 2 patients served metrics, one for outpatient, one for inpatient. The outpatient one continues to be better than baseline, which means we're ahead of where we were last year on our outpatient services. This is basically everything but the emergency room. We're not quite at our budgeted target, but we're closer to the budgeted target than we are to last year's. And then admissions, which includes the observations plus the admissions, is slightly lower than where we were last year. The inpatient admissions, as Julie mentioned, is very, very slightly higher than where we were last year, but the observation emissions are lower. That's what brings this overall emissions number lower. And then Julie just talked about the cash flow from operations metric, which is obviously in the red. And then this is the last slide, which summarizes a number of topics that we're working on and focused on right now. So the first one is physician recruitment. So in our clinic, Coastal Healthcare, we have a new orthopedic surgeon who has signed on the dotted line, and she'll be coming to us from Cleveland later this year. We're hoping her start date is November 1st. She is going to be an all-around general orthopedic surgeon, so she'll take calls, she'll do everything as you know that comes through the door that makes sense for our hospital. And she specializes in upper extremities, so elbows and shoulders. And she's like a big surfer and skateboarder, so she's like super excited to be here and be in this community. She's from around here originally. We also have a general surgery candidate to replace Dr. Brandt, who left for to be with family in the Pacific Northwest. We are hoping to get him signed on the dotted line within the coming days. I have another phone call with him tomorrow morning. And hoping to get him here by the end of the year as well. But in the meantime, outside of, you see I have general surgery on there twice down on the fourth bullet point, because we have non-coastal healthcare general surgeons in the community who have come to us. Mohammed Al-Tamimi is one, and his partners are hopefully future ones as well. But Dr. Al-Tamimi will start taking a little bit of call and backing up our coastal health general surgeon, Dr. Nolan, in September. And he's really excited to bring his practice here with us as well. And hopefully bring one or two of his general surgery partners here as well, so that we can make sure that we always have general surgery call coverage in the emergency department. Radiology, Phyllis has talked about this before, but our RADS Inc. group continues to do great work. They're in the process of recruiting additional radiologists, including those who can do interventional radiology, which would be done in the cath labs. We hope to be able to start doing those within a couple months. The hospitalist coverage, so for adult hospitalists, since the USACS group left, Kaiser has done a great job of stepping up and doing covering the whole hospitalist group on September 15th. Kaiser will go back to their original model of covering half of the adult hospitalist program. And Dr. Hassan Hazrati will be taking him, and his group will be taking over the other half. Dr. Hazrati works great with the Kaiser group. He and Dr. Angel, who runs the Kaiser hospitals group, have been working in concert over the last couple of months to plan what that's all going to look like and how they're going to share all the coverage. And Dr. Hazrati has been here before, worked here many years, and so he's, you know, we're really looking forward to that. He's been in conversations with the cardiologists about what cardiology coverage looks like as cardiovascular services start to grow. So I think we'll have a seamless transition to back to the new group model starting on September 15th. We have got, as you've hopefully noticed, the hospital signage. The new logo has now been installed. LED lighting throughout the hospital is still underway, but has made quite a bit of progress. As you'll recall, once that's fully installed, that'll save us about $10,000 a month on electricity costs. We are finalizing a new software program for OPPE, ongoing professional practice evaluation. That's an area where our medical staff office has identified as an opportunity for improvement, and our medical staff in continuously tracking the professional evaluation of our physicians and their quality, their clinical quality. And so we'll have new software that will be able to allow us to do that better. With the financial and volume challenges and decreases that we've had, we're continuing to look at making sure that our ancillary outpatient services are right-sized. Physical therapy is one where we had some extra hours that we felt like we didn't need, so we reduced some hours there. working in concert with our physical therapy. That's a contracted service that we have, is our physical therapists with rehab practice management. So we've worked with them closely, and we're looking at all those ancillary outpatient services to make sure that we're staffing to the hours and scheduling for the hours that we need for the patients that we have that are coming in. And then, we are, we do have some aging plant stuff, right, which was part of the reason for the bond measure. And so we have had in our medical office building side of things, not in the hospital, but in the medical office building, we have had an AC unit that has had some pretty serious leaking issues into some of our office space. And so we've been working around on some mitigation plans. We'll hopefully be able to use some bond proceed dollars to be able to mitigate, fix that as part of our roof repair project, which is part of our measure in dollars. So we've got that going on as well. That's what I've got for today. What questions can I answer for the board?
Any questions for Steve on his report?
I guess the other thing, now that I'm looking back at my notes and Roseanne's question, so I mentioned the OR growth in terms of the surgeons that we're recruiting. We're also, the gala is going to be specifically directed towards raising money for the operating room. We already have some money set aside in the foundation for an operating room refresh. So we're looking at a new tower and the cameras and scopes that go along with it, as well as looking at the flooring and the walls and the wall covering and the cabinetry and things like that. We ideally want to get to a point where we've raised enough money to do that for 2 of our operating rooms, because we're typically running 2 every single day. But if we can refresh 2 of them with new equipment and new surroundings that are clean and safe, then that's our goal. So some of the money that we have saved already in the foundation and what we raise through the gala will go towards that. And we'll see if we have a remaining gap, but we think with that, we're getting pretty close to being able to refresh 2 ORs. So more to come on that.
Any other questions for Steve before Steve, just my curiosity, I think I've been in a couple of these HR1 impact presentations that you've given over the last few weeks. What's your general sense about community reaction after this, during these sorts of presentations, of the questions that they might have, and I guess the overall comments that you've received so far?
Yeah, not a lot of questions, just mostly a lot of sympathy and anxiety and how can we help. That's really the reaction I get pretty universally, regardless of sort of who the audience is. And it's all been these community meetings that I've been to present this. And so one of the things that we're working on with our external affairs team in the facility is looking at providing a kind of a 1-page, half-page summary of talking points that we can provide to those community groups so that they can help us tell the story of what the impacts look like and what we're doing about it.
Okay. And then the other question I had is, I don't know if you have any additional information about the hospitals group that's going to take over the second half, other than I don't know the doctor in the group, anything they could add on to that about where the doctor's from, if they currently operate in this area.
Yes, but Dr. Hazrati has been here. When he was with USACS for a bit. And then he started his own group essentially, and he's been in other hospitals in the local area, not in but in this kind of in the Central Valley and San Vito. But he's recruited some great docs, some of whom have been here before, and who have had good relationships with Clay and with the other Kaiser docs. So I don't have a name. There's no name for the group that I'm aware of. It's just Dr. Hazrati and his group.
Yeah. Okay. Cool. Good to know. If there's no other questions, I do want to, please.
This is. I guess, now I'd be old enough, we were talking about opening this with the service league, the cafe.
Yeah. That is with the city right now, because it's a quote unquote to the city new location to have retail space in. We're in the licensing process with the city of Watsonville. So we're not done with that.
Been a rough year all the way around, Marcus.
Nothing's easy.
Yeah.
Yeah,
Okay.
Thank you.
Yeah.
we get the right people on it, but
There's no other questions. I do want to open up to public comment. Anything else to add? Okay, anybody online wishing to speak on item number 5, the Chief Executive Officer report?
No hands online.
Anybody in person, please, Roseanne?
My name's Roseanne Harris. Just gonna make a statement. I may have missed it, but in regards to anesthesia coverage, I know that, you guys have been working very hard to get, coverage. Seems like there's still some gaps, and I wanted to see if I missed that part of the report. Thank you.
Okay, anybody else wishing to speak on this report? Public comment? Okay. Steve, can you speak to anesthesia coverage?
sure. As far as I know, we've had few or no gaps recently. That could be, I suppose that could be erroneous, but we've had a conversation with LifeLink just earlier today about making sure that those gaps are filled, and we have the opportunity here coming up soon to negotiate some new terms with them in terms of, because we haven't had, in the time that LifeLink has been here, the contract hasn't really had good performance indicators or metrics in it. And we haven't really had any teeth in the contract in terms of if there is a gap in the service, what are the remedies for us? And so I'd love to hear from the direct users. We'll be talking with the surgeons, but if there are staff who have thoughts on that as well, I'd love to hear that, because over the next 90 to 120 days, we'll be renegotiating what that looks like. And we want to make sure that our contract has the right clauses in it. And I'll go back and look at the schedule and see what our current gaps are, because my understanding was that there weren't any and hadn't been any for a while, but I see Roseanne shaking. So I will look again. Thank you.
Thank you. Okay, any comments from the board before I move on to item number 6? Any comments on? Okay, cool. We'll move on to item number 6. It's the Watsonville Community Hospital Strategic Planning and Marketing Committee update, member removal / appointments. Steve, whenever you're ready. I appreciate it.
Item number 6, this item is about the membership. We will talk more about the content of the Strategic Planning and Marketing Committee in the district meeting. But in terms of the membership, we would like to ask to pass a motion to thank and formally excuse Matt Ranges, who was on the Strategy and Planning and Marketing Committee as our COO. And since he has departed, we would formally remove him from the list and add Lisa Nell, who works in administrative support and whose letter nominating herself and asking to be a part of the committee and adding is in your packets. So adding her to the Strategic Planning and Marketing. And this recommendation comes from the group.
I'll just give the added context that both myself and Dr. Gallagher sit on that committee. Any questions for Steve or for Dr. Gallagher about the appointments? Okay, I'll open it up to public comment. on this item, on item number 6? Anyone online wishing to speak on item number 6? Okay, seeing none, please, Roseanne.
So quick comment, it seems like a very important committee. And I was just curious what the qualifications were for, being appointed to that committee. And also if there were any other people, looked at as candidates for that appointment. So with that.
Yeah, I can answer that after we're done with public comment, then I think Steve could add in as well. Anyone else wishing to speak on this item before I close down the public comment? Okay, I'll close down the public, seeing none, I'll close down the public comment, and I don't have the bylaws directly in front of me in terms of who's allowed on the committee, but I do believe that when we established this committee, we did send out, and this is probably before Steve's time, if I remember correctly, when we established the committee. We did do,
Well, it was established before I got here, but I
Right.
don't think it met.
it met,
I
right?
think it first met a year ago.
Mhm. And so we did do, I believe, staff-wide recruitment for people interested in, joining the committee. And I believe that we have it in there, and Dr. Gallagher helped me, put this together, the actual bylaws of this, of who is allowed to be on there. And we were looking for a good representation of both frontline staff, mid-level, managers, and then also, folks that are in administration, whether they be in assistant, capacity as Lisa is in the recommendation before the board, or someone on the leadership team as Julie serves on the board or on the committee as well too. So always looking for more people to be interested in joining our committees. We understand how busy everybody is at the hospital and all the work that goes into just keeping all of our patients and our staff happy. But always looking for additional attendees, always looking for additional members of the committee to come forward as well, so. Yeah, of course.
You can find the bylaws for the hospital on the district website, pdhcp.org. And if you go to governance and then hospital, the bylaws are there as well.
Okay, if there's no other comments or questions from the board, I'll entertain a motion for the recommendation for item number 6. So moved. Can I get a second?
Second.
All right, thank you. I'll take roll on this item. Director Cox?
Yes.
Director Gallagher?
Yeah.
Director Creel?
Yes.
Director Pimentel?
Yes.
And Attorney.
Yes. Okay, thank you. We'll move on to item number 7. This is the Philips CT services or service agreement. And Steve.
Yeah, it's me. So looking to the board for authority to, give me authority to sign a service agreement with Philips to cover our existing in-house CT scanner, which will enable the service activation to ensure uptime, reliability, and move forward with our imaging projects. The CT scanner that we have in-house is a Philips CT scanner. It is 7 years old, so it definitely still has life left to it. And we, as you know, have signed with Philips for our new imaging equipment. The CT scanner is one that we will be keeping, so we'll be adding a second CT scanner through the Measure N dollars. But in keeping the older 7-year-old one, we want to make sure that it is serviced by Philips rather than serviced by a third party, which it has been for the last 7 years. And we want to make sure that Philips keeps it up and going, which we did have some challenges with that with a third party service provider last year. And so as a result of that, we've had a $35,000 a month CT trailer outside the emergency department as backup for the in-house CT scanner. So what we would like to do is we would like to sign this service agreement that would put Philips in charge of the maintenance and uptime of the existing CT scanner, and they will guarantee 98% or better uptime. And that will give us the confidence that they have all the right parts and the right know-how to keep it going, and that we can get rid of the CT trailer. And that's important, A, to save the $35,000 a month on the CT trailer, and B, because there's gonna be an MRI trailer that goes in its place. Because we need to keep an MRI trailer here on site while we replace the existing in-house MRI scanner. So this signing of this service agreement will allow us to sort of move forward on all that stuff that's in that critical path for these projects. And so, and it's $88,527 a year with Philips. And we will then be able to save close to that amount with our third-party administrator by them not having that on their contract anymore. And since it's a 6-year agreement, you multiply the 6 by 88,527, and it's over my signing authority, so that's why I'm here.
Thank you.
That makes sense.
Any questions for Steve about this? Please jump in.
Steve, I see that it says parts and labor included. As they go through this machine, do they expect there's gonna be additional cost for upgrades or modernization, or is that all included in this $88,000?
That should all be included, and Nellie's here. Do you want to answer any more details on that, Maureen?
Yes, so the.
Nellie is our imaging services director.
Nellie, if you're comfortable, you can approach the podium. Yeah.
Yes, the service contract should include everything, so parts and labor, the point is to be able to have full coverage service for the scanner. Service hours are gonna be a little restricted because once we have a new scanner, then we want to make sure we'll always have one scanner going at the same time. But as far as your question, yes, that will.
Thank you. I have a second question. Sorry, Matt. Steve, I thought the CT trailer was gonna be covered by Measure M money.
It's not eligible.
It's not actually.
No.
Okay.
Because it's not technically part of a construction project. The MRI trailer that comes with the MRI project will be.
Okay.
Nellie, did you want to add anything to, I'm sorry, I don't know. No?
No.
Okay.
If you guys have more questions, I'm happy to answer. Otherwise, I will talk your ear out. No.
Any other questions for Steve or for Nellie on this item? No? Just thanks for your work on this. I understand, you know, it's exciting to have the dollars to actually start to do these renovations that the community voted for. And then actually doing them operationally can be challenging, right? Because we have to make sure that that service is still available while these renovations are ongoing. So just thank you for all the work that went into this, putting this together and bringing this forward to us, and a lot different in the public atmosphere, right? To come back, having to get an agreement from or approval from authority from that sort of stuff. So just thank you for your patience on it. Any other questions before I open up for public comment? No? Okay, I do have to open this up for public comment. So anyone wishing to speak on item number 7, this is the Philips CT services agreement. Okay, seeing no raised hands. Anyone wishing to speak on this person? Okay, seeing no one raised hands, I'll close down the public comment and I will entertain a motion from the board on item number 7.
I move to approve.
Okay, can I get a second?
Second.
Thank you. I'll take roll on this item. Director Cox?
Yes.
Director Creel?
Yes.
Director Gallagher?
Yeah.
Director Pimentel?
Yes.
And Chair Jenkins?
Yes. Okay, thank you. That'll bring us to item number 8. How do you pronounce it? 556? Fixes. There you go. Fixes contract extension amendment. This is again, Steve.
Yeah, so looking here to get granted signing authority for the 5-year extension of the contract that expires in March 2026 between our hospital and Pyxis for pharmacy medication storage and tracking. So Pyxis, or Care Fusion, it provides our secure medication storage, tracks what medication is being dispensed and by whom and to which patient it's going, interfaces with our MedHost EHR for billing and charge capture, and tracks our controlled substances as part of our diversion control plan. The proposal is one where if we sign it now, then we're actually going to have a lower cost over the next life of the contract Whereas if we waited until April, the cost would go up significantly. So those numbers are in the board memo and the packet, but essentially it comes out to 162,854.40 per year, which is a significant savings over if we waited until April to renew it. So our pharmacy director, Jen Gavin, has brought it here so that we make sure that we do that.
Any questions for Steve or, Director Gavin? Anything else you'd like to add before I open up to questions to the board?
Hopefully it's kind of a no-brainer.
Mhm.
It's a nice, they're incentivizing us to stay with the system. It's a good system. It has a lot of positives and we're not gonna have to, system, we don't have to do training, it's a system that's working very well. And Steve's right, I'm gonna make a couple of changes that will benefit some areas. We're not using a couple of units, so we will actually be spending less money, not a ton, but probably about $10,000 less with signing this contract. And I'll immediately transition some things out, but this does not start, the 5-year doesn't start until April of 2026. So it ends up being 0% increase lease, 5% increase on support, which is fantastic.
Any questions for Steve or for Director Gavin? Okay, I do have to open up to public comment. So anyone wishing to speak on item number 8, online?
No hands on.
Okay, anyone wishing to speak on this item? Okay, seeing no hands, I will close the public comment, bring it back to the board for a very appropriate motion.
I'll move approval.
Okay, can I get a second?
I'll second.
Thank you. I'll take roll of this item. Director Fox?
Yes.
Director Creel?
Yes.
Director Gallagher?
Yes.
Director Frisbee?
Yes.
Director Nunes?
Yes, thank you. We'll move on to the final item of the hospital meeting. This is the item number 9, the emergency department monitor purchase. Steve.
Thank you.
Busy man.
So this is a recommendation for signing authority for the purchase of patient monitors in the emergency department. And this project is funded by a grant from the Alliance. So the Alliance, about a year ago, gave us a grant for patient monitoring. We have already purchased, and I just saw that it was in use today, the MRI Safe patient monitor. So we've been using that for a bit. That came out of this Alliance grant, and part of that patient monitoring grant is also to buy brand new patient monitors for the emergency department. So we have funding up to $586,682 from the Alliance grant specifically for the emergency department monitors. We went through a pretty rigorous selection process. Earlier this year, several vendors were invited. Physicians and staff came to the sessions to participate in the selection process. Neon Coden was selected. They have comprehensive platform, user-friendly technology, and innovative options for the emergency department to keep clinical eyes on all of their patients at all times. So happy to take questions and hope for approval so that we can go forward and use the Alliance grant money that's just sitting there waiting for us to do this.
Please, Steve, this is gonna be adequate for the newly reconfigured ER, the expanded ER, or we're gonna need to buy some more stuff?
No, so we'll, it's just the monitors for the patient rooms that we have now.
Got
And the system, so sort of the central plant of it will be available to be tapped in to with the new rooms that are built. But the new rooms that are built will need their own new monitors, which would be part of the expansion project.
Do you have any insight into why Nion was selected by staff as the preferred vendor? Was it a combination of pricing, quality?
It was a combination of pricing and quality. Kirsten, you're nodding your head. You want to talk about it? So Kirsten, Palmquist is our Director of Education, Clinical Education and Nursing.
Kirsten, if you'd like, you can approach the podium as well. You don't,
See, I'm.
no, I don't force people to do anything,
You're in the front row.
except for Jen, or
Kirsten,
Director,
thank you.
Director Gavin.
We're excited.
Sorry.
I'm Kristen, I'm Director of Education. We run coding with, and in addition to two other vendors, we at the time have us do demonstrations. And I set up central and their monitors. We have staff circle through, we have AccuView, we have and we have representation with the Amazon interactive processes. And we also looked at how possibility of how this would be easily tagged throughout the facility. So that would make focus. So that would not be a future best.
Yeah, so we have quotes for them for monitors for the rest of the hospital as well, which we obviously don't have the grant funding or the overall funding for that, but Coda does want to do that with us eventually. So that may be a future grant opportunities to get funding for the rest of the place.
Thank you. Yeah, thank you, Kirsten.
Any other questions for staff on this item? Okay, I do have to open it to public comment, so I will ask if there's anyone wishing to speak on this item online. It's item number 9, emergency department monitor purchase.
No, down the line.
Okay, anyone wishing to speak on this item here? No, please, go ahead.
I just have one question and if I can just. I was curious if the ER stuff will be compatible to our inpatient in regards to art lights. And I didn't get that with the training, if they have vendors come. I'm curious if, because I'm just imagining if they're putting it in an A line, if it's gonna travel to an inpatient. And I just want to
So
communicate.
I'll take the other public comments and then I'll circle back to the questions. Is there anyone else wishing to speak on this item? Public comment? Please. Yeah.
Jennifer Gavin first. So respiratory therapy was involved as well, so we participated. I didn't know anything about the equipment. I'm a pharmacist, right? I went, but what I was impressed about was I was impressed with the company. They have, best way for me to explain it is they have a very Japanese approach to their product. They're proud of their product, they can stand by their product, they're not gonna walk away. So my thought is that if we have things that we need to work through with them to figure those things out, they would come to us. I don't see it like, because I don't get impressed with people, but they're part of their presentation was the main folks that had founded the company and the whole information behind the company. It was a good presentation, and I was impressed with the folks that came, and I don't think they're just gonna sell product. We got that also as supporting information from some of the other folks that they've worked with in their support and upgrades, and we have their products stay intact. We can abuse them a little bit, and still, they're nice for the products, right? So, my 2 cents.
Thank you. Anyone else wishing to speak on this item?
Like GUS.
Hello?
Hi, Jim Ponce here. As your foundation and grant writer and getting, these large grants, it really does bring me much joy to see our team, our nursing team excited about these investments. I think that our hospital hasn't seen such large purchase and equipment and investment, and I think it's a great opportunity to share with the public that we are making investments in their community hospital, and whether it's through training with our staff, medical equipment, I think the synergy is moving forward, and I just want to acknowledge the team and the work and thoughtful process in making sure that we purchase the correct equipment to serve our patients. So that brings me much joy, and I'm just sharing the joy. Well,
Thank you.
Thank you, Janelle. Anybody else wishing to speak on this item? Okay, seeing none, I'll close down the public comment and, I will, entertain a appropriate motion for item number 9. If there's no other comments from the board about this. I would like to make one comment, but I'll also entertain the motion. Sure, I just, first off, just, again, thank you to June and to the foundation for going out and seeking these grants. I mean, these are exactly the sort of things that we can do as a nonprofit, community-run hospital. And these are the sort of improvements, while we have challenges in other ways, that we can go out and work with our partners at the Alliance to improve healthcare services here in our own community. So just thank you, June, to the foundation and your team for looking for these grants and being successful in getting them. And then, thank you to the hospital, directors of really, I understand we had the money sitting there for quite some time, but just taking the time and working with staff to make sure that, yes, this is the equipment that we all agree is going to be best for our staff and for our patients. So just thank you for going through that process and however rigorous it was. And, I know that it might have delayed the timeline a little bit in terms of making a purchase and getting the actual tools to the people who need it, but making sure that it's going to be there for the long run and folks are confident and feel comfortable with the tools that they're going to be working with on a day-to-day basis is big. So I appreciate that attention to detail. With that, there's no other comments. I will entertain a appropriate motion. Please.
Seems to me over the years, the Central Coast Alliance has been incredibly instrumental.
Yeah.
In making lots of equipment upgrades here. I wonder if the board should thank the Central Coast Alliance in some way to sort of do that. I like this sort of.
They also have public board meetings, so that may be,
Yeah.
that may be a way to do it, is for somebody to go there. That would be great. Okay, yeah. I'm not saying it should be you, but it would be great.
I was in a meeting with someone from them today and I just thank them for everything they do anyways, but,
Yeah.
yes, every opportunity I get, I say thank you. No other comments? I will entertain appropriate motion. Anyone?
I'm happy to make a motion for emergency department monitoring purchase as outlined.
Can I get a second?
Second.
Thank you. I'll take the roll on this item. Director Fox.
Yes.
Director Friel.
Yes.
Director Gallagher.
Yeah.
Director Pimentel.
Yes.
Chair Newman.
Yes. Okay, thank you. That brings us to the end of the Watsonville Community Hospital Board meeting.